Pneumonia is an infection of the lungs. It can be caused from bacteria, from viruses, and even in some cases from fungi. So we're going to go ahead and study all about this lung infection today. Turn to Davis chapter 24, grab your Exemplar worksheet, and study along with me. There are 3 to 4 million cases annually in the United States of pneumonia, and patients can either get these cases in the community, just from catching it, at the grocery store, at a restaurant, or from someone who's sick in their house, or it could be hospital acquired, and sometimes patients who are intubated, for example, can acquire pneumonia from being in the hospital. Risk factors for getting pneumonia: the very young and the very old, certainly. Those who have had recent antibiotic therapy, those who are immunosuppressed, who have a lowered immune system, either because they're on steroids or they're doing chemotherapy or they have a history of HIV. People with chronic disease, people with COPD and asthma and heart issues, because they're just more frail overall, are at higher risk. And then those who receive treatment in healthcare facilities like dialysis, rehab, or adult daycare, because they're exposed to more people more frequently, and so they have a higher chance of getting it. So what is pneumonia? Pneumonia is inflammation of the lung tissue, and this again can be caused from bacteria, from viruses, or even from fungi. Pneumonia is transmitted through droplets, so it's inhaled into the respiratory tract and then settles way down into the lungs. And as this inflammation happens, those lung sacs, the alveoli in our lungs, fill up with fluid or with pus and make it harder to breathe. And that's why the patients feel short of breath and they've got those coarse crackles in their lungs. All that fluid is just filling up in the alveoli sacs. So you'll see that pneumonia here can either be localized or diffuse. These 2 examples are on the top, show a localized pneumonia, an area of consolidation in one of the specific lobes of the lungs. You can see it on the x-ray here in the whiteout. Or it can be a diffuse pneumonia, where it's just patchy little areas of this inflammation and fluid buildup in the lungs. And then on an x-ray, it looks like this patchwork of white. So when you're looking at an x-ray, all the black means air, and white means something solid, like the heart, and also like the fluid that's building up here. So we can see both localized or diffuse pneumonia. Signs and symptoms of this lung infection include a fever, shortness of breath as those alveoli sacs fill up with inflammation and with fluid, a productive cough with either yellow or green sputum, changes in the mucus, thicker, more green, more yellow, and then pleuritic chest pain. Pleuritic chest pain means chest pain on inspiration or exhalation. It can be sharp, and it's certainly related to breathing. Pneumonia is diagnosed both through a physical and history with the patient, but also looking at a chest x-ray like we showed you earlier, or maybe even a CAT scan if the x-ray isn't enough. And then we'll see our patients have increased white blood cell counts. Those are those fighters that our immune system puts out to help fight infections. So we'll see increased white blood cell count greater than 11,000, perhaps an increased C-reactive protein, CRP, which shows inflammation in the body. And then we'll see positive sputum cultures and maybe even blood cultures, where we're taking blood from a patient into these viral or bacterial petri dishes, and we send these blood cultures to the lab, and they are able to grow and see what kind of bacteria or virus grow. And then we can also take sputum cultures, where the patients hawk up a loogie from way down deep in their lung, and we put it into a cup, and they send it to a lab, and again, they grow that on a petri dish to see what kind of bacteria is growing, if any, or if it's fungal or if it's viral, to see what kind of pathogen we're dealing with. Now, treatment in terms of non-medicine, non-pharmacologic, is going to include oxygen administration if their O2 sats are low, and what we describe as low is typically less than 92%, and making sure that they're getting adequate fluids, as their bodies need more fluids to get over infections. And so that could be IV fluids if they're in the hospital, or pushing PO fluids at home. Medications, we use bronchodilators like albuterol that help open up those airways and help more gas exchange to happen. And then, of course, antibiotics. If it's a bacterial infection, we need antibiotic to kill it. And so based on the specific organism, the doctors are going to prescribe specific types of antibiotics that will kill off that organism. Since we don't know specifically what kind of organism it is at first, we always start with broad spectrum antibiotics that will kill off a lot of different types of bacteria, so that hopefully we hit the mark, and then we can get more specific as those cultures come back from the lab. Now, complications from pneumonia can be very severe, and they can include even death. So bacteremia means bacteria in the bloodstream. We test that through blood cultures. Sepsis is an overwhelming infection of the body, that the body is losing the battle against the virus or bacteria. Acute respiratory failure. Remember, it's kind of like if you do a sit-ups constantly for 5 minutes, at some point your body just won't be able to do any more sit-ups because the muscles just have nothing left. And our breathing can be like that too. And so if the patient is struggling to breathe, and eventually they're going to tire out, and then they can just stop breathing. And then multi-organ failure that goes along with the sepsis and the bacteremia, where the body starts to shut down as it becomes overwhelmed with an infection. So how do we prevent these complications? Well, we identified pneumonia early, and we treat it early. We give them oxygen, we give them those antibiotics, and we test the cultures to make sure that we're treating it appropriately so that this doesn't become an overwhelming infection. Let's go ahead and review the nursing process as it pertains to pneumonia. If you have a patient and you're thinking they might have pneumonia, these are the kinds of things you're going to see. They're going to have a fever. They're going to have low oxygen levels. They're going to have a faster heart rate and faster respiratory rate. And they may even have weak pulses if they're really progressing with this pneumonia. In terms of nursing diagnoses, we can talk about impaired peripheral and perfusion if they're getting into the sepsis shock kind of stage. Ineffective breathing patterns due to the tachypnea and the shortness of breath. An impaired gas exchange due to all the fluid in the lungs. And they're at risk for acute confusion. Oftentimes, older patients who get any kind of infection, we can see them have altered mental status as one of the signs and symptoms of their infection. Okay, remember, nursing interventions we divide into assessments to take, actions to take, and teaching to do. So once you know someone has a pneumonia, these are the things you're going to monitor. You're going to watch their vital signs, their neurofunction. Are they ANO times 4? How are their breath sounds? What do they sound like? We would expect a patient with pneumonia to have crackles on the lungs. What are their peripheral pulses like? Are their radial pulses strong, or are they weak or thready? What do their secretions look like when they're coughing and it's a productive cough? Is it green? Is it clear? Or is it yellow? And has it changed? We're going to take a look at those lab results we talked about, and then we're going to monitor their input and output because they're at risk for fluid deficits when they have an illness. In terms of actions to take, we're going to administer humidified oxygen as ordered, administer medications as ordered, including those antipyretics, analgesics, bronchodilators, and antibiotics that are actually going to cure it. That's what antibiotics do. We can do pulmonary hygiene, where we kind of, do some percussion on the back of their chest and have them take nice deep breaths and help sometimes move things and get those secretions loosened up. We want to position them in either high or semi-Fowler position so that they can get a lot of good lung expansion and breathe easier. Watch their intake and output. Consider their nutritional status, and consider their activity, providing them times of rest, but also times to, get up to a chair or ambulate to the bathroom so that they don't develop complications from immobility. In terms of teaching, we want to prevent the spread of this pneumonia. So we want to encourage them to have good hand hygiene, washing any frequently contaminated areas. encouraging them to have lots of rest so that their body can fight off this infection. Make sure that they take the antibiotic as prescribed. So if they're going home on oral medication, they need to take that antibiotic all the way until the course is done, even if they're feeling better. If they don't take it like that, they are likely to have the infection come back. We want to encourage them to have good nutrition and fluid intake. We need increased fluids when we're sick. They need to know what signs and symptoms to watch for of getting worse. Increased shortness of breath, activity intolerance, chest pain, altered mental status. Those would be reasons to call the doctor or seek emergency assistance. And then we want to encourage our patients to get their pneumonia vaccine. Our older patients and those who are immunocompromised or at higher risk for pneumonia should receive a pneumonia vaccine. And as always, evaluation is the last step of the nursing process. So we are going to make sure that they have stable vitals, that their fever is gone, that their oxygen status is at least 92% or back to their baseline, that they have no more cough and that they are not coughing up any, thick sputum anymore, that their chest x-ray looks clear, and that they've got increased energy levels. Those all tell us that they're back to their baseline, and those are the things that we're going to be watching for. And that's all you need to know for the exemplar of pneumonia. Thanks for listening, and we'll see you soon.